most common spots for knee pain, and we're going to be working on the soft tissue and the release portion of this. There are also 3 more steps after we do this, but in order to get these, I need you to understand that knee pain is not from the site of the knee. There's always going to be pain below the knee. It either stems from 3 places: below the knee, from the knee to the hip, or at the hip itself. There's no other way. So we're going to go through 3 of these. And number 1 is the anterior tib. And the anterior tib is from the knee to the ankle. And it's this big muscle that sits right on your shin. This guy gets mad very easily. It happens from jump roping, from running, and it happens to be the number 1 cause of knee pain. Believe it or not, you'll get this little tiny ring right here. So how to do this: I use a foam roller. I just kind of find a spot, and it's gonna hurt. It's like a good 12 out of a 10 for pain once you find it. But you get on here, cross this leg, and just sit, point the toe, pull the toe, point the toe, pull. And you're just gonna sit here until you actually feel a little bit of a release. The thing you have to watch out with the anterior tib, there's a nerve that runs through it. So if you get nerve pain down in your feet, move the foam roller like half an inch. But just find this, pin it, point and pull. Number 2, we're gonna use a nice 5-inch massage ball. Now this one's hard as a rock. This is a skills ball. You could also use a Trigger Point MB5, a softball, or something comparable, right about a 5-inch ball. This one's gonna hurt. But the second muscle that we're gonna look at is the VMO. Now this muscle, when you look at quads, sits right on the inside of the kneecap, just above that kneecap. Now this guy causes a lot of pain, and this one, never really tight. It's always weak. And that's the problem that we get with this muscle quite a bit. So we're gonna flow this over, and we're gonna lay on the ground. I call this the magic mic, the Channing Tatum, whatever it is. And we're gonna put our knee just out to the side. You're gonna put that ball about 2 to 3 inches above the kneecap on the inside of the leg. And we're just going to, same thing, pin and stretch. If this hurts too bad to actually do this, just sit with your foot here and just hold it and just keep breathing for about 30 seconds. Same goes with the anterior tib on the lower half. 30 seconds to about 2 minutes is what it's gonna take to get these to let go and release. Each one has a different pain, and they both hurt a lot. And this is the thing, when you start doing a lot of self-myofascial release and you're doing a lot of these releases on these muscles, the pain threshold that you're gonna face is gonna be determined by how much pain you can handle. Because there is no easy way to say this, but they all hurt a lot. Just different pains and different buckets. But just sit here and holding this, we can either do an active pin and stretch, or we can just sit here and just roll this back and forth. But just find that spot and just wait until that pain subsides to about a 6 out of a 10, because it's still gonna hurt, 5 or 6. So number 3 requires a little lacrosse ball here. And number 3, this is the Dix, just a little tiny lacrosse ball, still hard as a rock. And this one is to pinpoint a lot of the smaller muscles that you just can't get with a foam roller or a 5-inch ball. Now with this one, we're gonna look at what's called the TFL. Now a lot of IT band syndrome that you see is all based upon the TFL being either extremely weak or extremely tight. Now, tightness does not equal weakness in this case, but in my case, my internal rotation is something that doesn't really get looked at too much. Now this, how I'm sitting is like hip flexion with external rotation. That's how you would sit. But in order for the TFL to work, the TFL is responsible for internal rotation and your knee going in, which is adduction. So lifting it this way. It's kind of an odd muscle, but it's very small, but it attaches to the IT band, which creates this little loop of pain on the outside or a horseshoe around the kneecap. Take a lacrosse ball, and how to find this muscle is you're gonna find the tip part of your femur, this big bone right here, right on the side, and then you're gonna find your pelvis, ASIS. point there, and then right at the femur. It's right in between those 2 points. If you were to draw a line from the femur to the ASIS, take that ball, it's right on the outskirts. And once you find this guy, let me tell you, you're gonna bite your hand. You can't miss it. So what I do with this guy is you can dictate, put this knee either in hip flexion, put it behind, but ultimately just sit here for about 2 minutes with this ball. You don't even have to lift the knee. And to make sure you're on it, what you can do, take this knee, lift your knee off the ground because it'll flex. Weirdly enough, that thing flexes when you lift the knee versus pressing it. It's a very odd muscle. And you just sit there and breathe, holding it, and just wait till that pain goes from about a 12 out of a 10 down to about a 6. If you have pain in this, it's gonna take you a few days to get it out. If physical pain actually happens as we do this in our day-to-day activities, you know it's gonna hurt to get it out. That's my goal interval. I can't tell you this enough. But with this one, just kind of flex your butt a little bit and then relax it. I have some tricks. And just breathe it out. Those are your top 3 spots